Hi, I'm Stefan Barta. I'm an associate professor at the University of Pennsylvania, where I lead the T-cell lymphoma program. The second opinion is your chance of getting another set of eyes laid onto the diagnosis that's been made for you and give a recommendation regarding the best next steps in treatment. Second opinions are important because T-cell lymphoma are a rare cancer. They're very heterogeneous, meaning there are multiple subtypes, and some of them are exceedingly rare, so that oncologists who see patients with all sorts of different cancers, like breast cancer, lung cancer, etc., they may not have seen this lymphoma or see it only very rarely and therefore are not as familiar with the management of the disease. And furthermore, a second opinion also gives you a chance to have another pathologist look at the biopsy slides and make sure that the diagnosis is actually correct. Patients with T-cell lymphoma who went for second opinions to tertiary centers where there are T-cell lymphoma experts had the diagnosis changed in nearly 1 in 3 cases to either a different subtype of T-cell lymphoma and sometimes even to a different lymphoma. So it's really important to A, make sure the diagnosis is correct, and B, the treatment plan is really well thought through and personalized for the diagnosis that you have. I think in general, it's always a good idea to get a second opinion. We do it all the time in our private lives, getting second opinion from other people, just to get a variety of different thoughts on how things are best managed. But for T-cell lymphoma, it is particularly important given that there is often not an established standard of care, so people may approach things differently. And it's good to make sure that what has been suggested is really in line what somebody who sees a lot of this rare disease also would do for your disease. I think it's very important to really prepare well when you go and get a second opinion. And that means that the person who gives the second opinion has all the information available to really make a good judgment. So you could, for example, make sure that you have all your copies of your reports, that this person who is giving you a second opinion has access to your imaging, so to your x-rays, PET scans, etc. And you could, for example, also try, sometimes it helps to bring CDs that have digital copies of these images to your consultation. It's always a good idea to bring a friend, so a second set of ears, or a third or a fourth. So bring people whose opinion you value, just because it is always very overwhelming to get a lot of information at the same time. And it's helpful to have other people listening in, taking notes for you, and asking questions that you might have forgotten. And brings me to the next point. It's a good idea to have questions already prepared, things that are really important to you, things that you would like to address, to have them written down to just make sure you get all the answers that you want. Well, usually I would say at the time of diagnosis, that's a good time because that's when the journey begins, and setting it off on the right path is, I think, a good idea. But sometimes that may not be possible because treatment may need to be initiated very quickly. So it may be that you already had started your first treatment, but it's still not too late to get a second opinion. Another good time is if you already had treatment in the past, but now the lymphoma has come back or is not responding as we would like it to respond. That's also another good time to get another set of eyes looking at the management and maybe make some suggestions as to what can be done next. So number one, you should ask why this opinion differs from what you have been recommended before, and just to make sure that the differences are really significant and not just really, it's just small little details. And then the next step is to discuss with your treating oncologist what they think of the second opinion and how it comes into their management. Usually, it's also good practice that the person who is giving the second opinion talks to the treating oncologist, and they usually, when there are discrepancies, are able to figure out a path forward that gives you the best next steps. In the rare cases where the opinions differ and the two oncologists can't come to a conclusion, number one, there are online resources that are accessible to patients, like the NCCN guidelines that are made specifically for patients, where you can look at what treatments are recommended in certain situations, and you can see which opinion really kind of is the closest to what is considered by some as the standard of care. The other thing is you have to go, you just ask other people who may be in the same situation what their experiences have been, and you might get an idea of which way you'd like to move forward. And last but not least, it could also be that you may ask even a third opinion at that point in time, which is absolutely okay. And we all have done second or third or even fourth opinions for very complicated situations. It can sometimes be scary to bring up a second opinion with your treating physician, because it may feel like you're not trusting their judgment. But from my personal experience, good physicians always value other opinions, and it may just be a confirmation of the path you already set and the treatment decisions that have already been made. So I would not be intimidated by that, and I would argue that the majority, nearly all physicians, are fine having their patients getting second opinions, and they may even be very helpful in identifying just the right person to give the second opinion.